record.
I always tell Crystal I can hear her accent, especially with her age. She'll say like dad or balance.
And sometimes.
Where are you from, Lisa?
I'm from California.
Okay. Awesome. Some of my family, Santa Barbara area. Are you familiar with?
Yeah, I'm in LA, so I love Santa Barbara.
Oh, it's like paradise, isn't it?
It really is. Yeah.
Its own little oasis, that's for sure. Well, everybody, thank you so much for joining us today. This is Lisa Gainsley. She is a certified lymphedema therapist, manual lymphatic drainage practitioner, author, educator, and speaker. She holds a double certification in lymphedema therapy and leads workshops across the country and has pioneered the field of lymphatic self-massage. She is also the author of her book called The Book of Lymph. So thank you so much for coming on. We're so excited to talk to you.
Thanks so much for having me.
Yes.
So why don't we start with, telling us what the lymphatic system is, because I don't even think many people know what that is.
I know. It seems like something we should learn in school, right along with the cardiovascular system and the immune system, doesn't it?
It does.
Yeah, it's funny. When my son was in 6th grade and they were studying the immune system, I said, y'all going to cover the lymph system? And they said, we weren't going to, but come in and teach it. So I did. I taught a little class on it for them.
I love it.
Because your lymphatic system is part of your immune system. It's often referred to as the circulatory system of the immune system or the highway of the immune system. And how they're commingled, what that means basically, is your immune system is born in your lymphoid organs. Your bone marrow is a lymphoid organ. Your spleen and thymus, the thyroid, the tonsils. These are areas where there's a lot of bacteria, high bacteria traffic in the body. And so there's lymph tissue there to help protect the body from disease. Your lymphatic system is a network of capillaries and vessels similar to the bloodstream, but it's actually twice as vast as the bloodstream. It collects excess waste in the body, including bacteria, viruses, cancer cells. It picks up immune cells. They all hitch a ride on the network. They go through the lymph nodes where those immune cells, the white blood cells, lymphocytes, B cells, and T cells, filter out the waste, and it keeps on going back to your bloodstream. You also urinate it out, but it's a really important detoxification pathway of the body to help rid your body of excess waste and toxins.
I love that. Can you talk about some of the benefits of lymphatic work for our listeners?
Yes, of course. So it really can range. You can help lose water retention. It can help reduce bloating. It can quell inflammation in the body, which we know is at the root of most chronic illnesses. It will help improve the appearance of your skin. So some people get glowing skin afterwards. Some people also feel lighter and brighter. Some people really get help with sinus congestion, breast tenderness, PMS symptoms. It's wonderful after surgery to help reduce swelling. It's great after an injury. There's been studies that have shown after an athletic injury, they compared it to Swedish massage, and lymphatic massage was way superior in reducing inflammation after athletic injury. And there's been studies done that it's beneficial for people with fibromyalgia and a lot of chronic issues. So there, it runs the gamut of how beneficial it is.
Yeah. And, some people walk around with a lot of bloating in their extremities. And I know that lymphatic massage can be really helpful for that.
Yes, absolutely.
So what type of clients do you see in your practice? Like who would you say can benefit with the lymphatic massage?
Well, like I said, everyone benefits, and it really runs the gamut. So I'm certified to work with cancer patients. So I used to work at UCLA Medical Center working with cancer patients, and in my private practice, working when people have had cancer treatment. Oftentimes they have lymph nodes removed to make sure the cancer didn't spread through the lymph system, but that can put somebody at risk they can get lymphedema, which is accumulated swelling in a limb. If they had lymph nodes removed under the armpit, they're at risk for lymphedema in the arm. So lymphatic drainage is actually covered by insurance in this country. if you have a note from the physician, a prescription from them, and you work with a certified lymphedema therapist, they can really help you manage lymphedema. But it also, runs the gamut to aesthetic reasons. People want to get glowing skin, be red carpet ready, lose a few pounds around the waistline, help the reduce appearance of cellulite. I've worked with people who have eczema. I've worked with autoimmune issues, people with the MTHFR gene that have issues detoxing, lupus, and Lyme, as well as young people who want to avoid some of the chronic conditions their parents face. They come in early because they know it's a proactive, healthy, beneficial type of massage.
Yes, for sure. So who should not be getting lymphatic massage?
That is such a great question. So I have a whole list in my book, the book.
Yes.
But if you have chronic heart conditions, if you have chronic cardiac edema, if you're at risk for a blood clot, if you recently had surgery, if you have an active uncancer treatment, DVT, there's a list that I have in my book. If you have an active infection, don't work. So if you have COVID, wait until you are, really over that active acute infection. Cellulitis, no working.
Yeah. Yeah.
And DVT, just so you guys know, is deep vein thrombosis, right? So that's basically where you get a blood clot, usually in your calf, that can be released into your lungs and become a pulmonary embolism. So you could see why massaging that area would be a problem. So, if you're walking around with calf pain, a good, I think someone who does what you do, Lisa, would know, that is not the type of person you probably want to take if there's any risk of that.
When in doubt, ask your doctor.
Yeah,
yes,
for sure.
Calling your doctor.
Yes.
So what are some of the symptoms you can experience after working on the lymph?
That is such a great question. Again, it's sort of a rainbow of possibilities. A lot of my clients feel lighter and brighter afterwards with more energy, but oftentimes people can also feel really drowsy and tired. Some people can get headachy if they're not drinking enough water. You are accelerating the natural detoxification pathways of your body that your lymph system works with. So just like you might feel on day 3 of a cleanse, if you've got a lot of toxins you're getting rid of, it might not be so comfortable. That can be normal. So I always tell people, try not to schedule anything that you have to rush off to after you get a lymphatic massage. Give yourself time to rest and drink plenty of water. And also pay attention to your diet. Don't just go run off and eat a bunch of processed foods. Try to eat clean before and after you're getting lymphatic massage.
Yeah, I have the MTHFR gene mutation, which many of our patients do because we work a lot with histamine intolerance and mast cell activation syndrome. And I can tell you that, after getting massage, if I haven't been massaged in a long time, I can sometimes get actually a cold. It kind of moves things around and starts removing toxins, which can actually kind of flare up your immune system a little bit, right?
Right. So that's why if you are somebody who knows they're susceptible to that, or knows they have the MTHFR gene or anything else that could trigger something, I always like to err on caution, the cautious side.
Right.
So that's why I like to have a conversation with a client first, find out what their triggers are so that we don't work too intensely for the first time I see somebody.
Yep, that's so great. That's really great because that just means you're so in tune that every person needs something different. And that's what we love. We don't like the cookie cutter approach.
Right.
We love individuality. So that's great.
Yes. And, depending on where you live and depending on what type of lymphatic practitioners is in your area, it's a little bit like the wild, wild west now.
Yes.
So anyone is just saying they do lymphatic massage, and so just be alert. What are your goals? Some people, they just want the aesthetic benefits, so they can go to someone who's just going to kind of use a machine on them and might be fine. But if you have any underlying health issues, really seek out somebody who is properly trained in the Vater technique, that knows how to work on a deeper immune level and with different health conditions, so that they do individualize your treatment.
Yes, I love that. Can you talk a little bit? I actually have had patients that has had experience with this, a little bit more about lymphedema, particularly for women and men, who've gone through breast cancer and they've needed lymph nodes removed. And I've had patients actually develop, mastitis easily after that, and just
Mastitis
really,
breastfeeding.
yeah,
Or
not from breastfeeding, after having the procedure, and starting to develop more lymphedema too in those areas. So can you kind of talk to me just a little bit, or us, about, how you work with that with patients who've had stuff like that?
yeah, so somebody who has had cancer treatment. So let's say somebody had breast cancer.
Yeah.
And they typically remove anywhere between 2 and I've seen people have 30 lymph nodes removed.
Right.
It's a lot of lymph nodes. But even if you've had 2 lymph nodes or just a sentinel node, they're still at risk for getting lymphedema. The way I like to sort of describe it, I like to use this analogy of you're cleaning a dirty ring around your bathtub. And what's the first thing you're going to do? And most people say they're going to just get the spray and clean the ring. And I say, you got to clear the hair out of the ring first.
Right.
Otherwise, what's going to happen when you clear the ring?
Mm-hmm.
You're going to get a bunch of germy water accumulated at the drain site. So when you think about the drain site being the axillary lymph nodes under the armpit, if you remove a couple, it's sort of like you're always going to have a couple spots in your drain that are congested.
Yes.
The good news is if you work with a certified lymphedema therapist, and like I said, a lot of times you can get a script from your doctor, work with somebody in a rehab clinic or at a hospital who's certified to do this work. And what they will do during their massage is they'll do an intake, and during the massage, they're going to reroute the fluid to other working lymph nodes. So there's anastomosis across the chest, that interaxillary anastomosis. So you massage towards the opposite armpit on the other side, and you massage to the inguinals at the top of the thigh on the same side you had lymph nodes removed, and you go across the back. This way you're sort of opening up all the lanes of traffic on the highway, if you will. If you've ever had a roadblock on the exit,
Yes.
you go around.
Yes.
And then, some of those people might also be candidates for compression garments. If you've ever been in an airport, you might see somebody walking around with a compression sleeve and a glove. So, it's important to develop a relationship with a certified lymphedema therapist if you've had radiation, if you've had surgery, if you've had a mastectomy, to really help manage an accumulation of fluid from a backed up lymph system or vessels that have been cut through during surgery.
Yes. That's awesome advice. Thank you so much for that. Because
you were talking about mastitis with breastfeeding.
Yeah.
So even if somebody didn't have cancer and they're breastfeeding, mastitis is something, right? Those clogged milk ducts that can develop, and they always say massage your breast. I'm a big proponent of people massaging their breasts early and often to really help prevent some of the breast tenderness that comes with the cycle and some of breast density. I've had clients on their mammograms, the breast density has gone down from doing their self-massage.
Is that in your book, Lisa? Like, do you talk about that? So this is a huge reason to get Lisa's book, because that's great. Knowing you obviously are not going to know how to do that on your own. I don't know how to do that on my own.
Yeah.
So I will be reading your book to do that myself.
Yes.
Let's talk about long haulers, with COVID. How can working on the lymph be beneficial for people suffering with long hauler syndrome?
Great question. So, a lot of what's going on is that extra inflammation, extra fluid in the lungs. And we know that there's a lung drainage pattern of the lymph system through the lungs. So I have in my newsletter, and I have a digital course launching where I show you how to do some lymphatic massage around the chest, around the lungs, to help clear out some of the congestion that can occur. Other people have other symptoms, neurological symptoms that are going on. And what I love about the lymph system is it works with the parasympathetic nervous system, the rest and digest state, where that healing really drops you into that healing state. So when you're doing lymph massage, you are also going to help the nervous system calm down and relax. Also, they're talking about with long COVID symptoms, issues in the brain. Doing lymphatic massage in the face, the head and neck is going to help clear out some of the congestions in the head. In 2012, it was discovered that you have lymph vessels in the brain that work alongside the cerebral spinal fluid to clear out the plaque in the brain when you sleep. So getting proper sleep, again, doing lymphatic massage, head and neck is wonderful for that. And any other symptoms that people might be having, it's a really great way to engage your lymph system to clear out some of the accumulated fluid and toxins that might still be going on in the body. We know that from the long COVID sufferers, they are having a harder time clearing out that waste. And this work was originally created in the 30s by Dr. Vodder to help move out symptoms after colds and flus. So it's really beneficial to engage your lymph system.
Yes, yes. Are you still seeing, I know you have your book and your program, like you said, coming out. Are you still seeing patients, Lisa, and practicing?
Virtual clients. I'm not taking any new in-person clients at the moment.
Okay.
But I'm having virtual sessions if someone's interested in booking a session.
We love virtual. We're virtual.
Yes.
Are you?
Yeah.
Yep.
Isn't it?
Yes, it is great. And so that's great because we love to have people to refer to.
It's really amazing. I was just on with a new patient yesterday, and I haven't gotten this in a while, but she was like, "Does this really work?" And I didn't want to say, "Well, we'll see, you'll see."
Yes.
Yeah. But I just said, some people really, say this and that, and within 2 minutes, she felt her lymph draining.
Wow, that is amazing. Yes.
I have to set up an appointment with you.
I know. We're going to be calling you, Lisa.
We're doing a duo appointment together with you.
Oh, it'd be so fun. I'm happy to do that with you.
Yes, yes. Can you talk more about your program a little bit, please?
And your book?
Sure. So the book is the Book of Lymph, Self-Care Practices to Enhance Immunity, Health, and Beauty. I wrote it to put the power into the reader's hands so they understand a deeper dive into the science of the lymph system, what it is. It gets a little technical. I try to make it not too technical, but just palatable enough so you get the basic foundation. And then I talk about how it's your missing link to health, how the directors of the National Institute for Health believe it's going to help uncover diseases in the digestive system, the respiratory system, infectious diseases, and even with neurological disorders because of how lymph flows through the body.
Yes.
And then there's a lot of sequences, self-massage sequences, in case you want to get a slimmer waistline, deal with earaches and headaches, menstrual issues. And there's also at the end other holistic remedies, why exercise is great for your lymph system, and other things like infrared saunas and castor oil packs. So I really unpack how those are beneficial for the lymph system. And my digital course, what's unique about that is some people really learn better visually. So there's video tutorials that help walk you through protocols to help you, whether you are a health coach and you want to give tips to your clients, or you want to use it for yourself to help alleviate some of the pesky symptoms that are going on in your body.
Which probably everyone can use. I mean,
yes.
I really, and it is hard to find a certified lymphatic, really someone who specializes in it, because I've looked in my area and I can't find one that's anywhere near me.
I know. And in my digital course, I have a link to help people find somebody in their area too.
Oh, good, good.
Yeah.
Can you talk a little bit more about your course?
Yeah, so it's a self-led digital course. It's going to be launching next month. And if you sign up for my newsletter at thelymphadicmessage.com, you get $100 off.
Oh,
that'll be running in September. And yes, and it's like I said, they're videos that are pre-recorded and you could choose based on what's going on with you, but you get access to all the 11 videos and a video on yoga for the lymph system. And there'll be monthly lives that'll be included.
Nice. That's great. Well, that is awesome.
And a downloadable PDF on how to speak to your doctor or your healthcare practitioner in case you suspect your lymph system is at the root of some of the issues going on. some of the doctors don't really know too much about lymph. So this is how to speak with your doctor to let them know, hey, I know this about my lymph system. Here are my symptoms, and how to ask them questions without offending them, but making them want to be an advocate for you.
Isn't that true that you have to tiptoe around other people's practitioners? It's crazy how, especially in the conventional medicine world, they're not willing to work with anything that is not conventional medicine. And it's really sad, because if we all just worked together, we could get patients the best care. But we run into the same thing. It's like, ask your doctor to order this, and their doctor gets so offended. It's like, we're just
Right.
trying to help
It's like,
people.
right. We are all just trying to help each other. And this is where I love the lymph system, is because it can't be discounted. It is a physiological, biological part of your body. It's not a made up system, right?
Right.
So they can't discount it. And it is covered by insurance. It is recognized by the AMA. So, you know, there's a way to sort of, if they don't know too much, for them to say, oh yeah, I can go find out more about that for you.
If it's covered by insurance, I think doctors are a little bit more willing to prescribe it.
And that's just for cancer patients, though.
Yeah.
It's not just for the run-of-the-mill person. Hopefully
Yeah.
we'll get there someday.
Well, what we were talking, Dr. Crystal and I were just talking about this, how people won't do anything that's not covered by their insurance, but insurance is sick care. It is not preventative care. They don't cover, that's why they don't cover what we do, because they don't cover 45-minute, sessions with someone who's helping them get healthy before they get sick, or get healthy without using drugs. So you really have to prioritize what's important in your life. And if, a person's shoes are more important than your health, then go that route. But really, is it? I mean,
I am so glad you brought this up. And that is actually another reason why I wrote the book, which is not everybody can afford, even if you have a practitioner in your area, a lymphatic massage is more expensive than a Swedish massage. And people can't afford that on a regular basis. So with my book, and even with my course, you're going to have lifetime access to affordable ways to help yourself. And that's really, those are the impetus to reach more people and to make it affordable. I don't see somebody on a regular basis. I work on myself. And I just want to reiterate that it is important to invest in your health and to find ways. I'm sure some of the things you recommend aren't expensive for people to change their diet. And yes, organic food is more expensive, but in the long run, it's going to be cheaper than a hospital bill.
Exactly. And cheaper than a bunch of medication.
Right.
Lisa, I love your Instagram page. You do share a lot of great videos showing people what they can do themselves, and it's really great.
What is your handle on Instagram? Can you tell everyone where they can find you, all the different places?
Yeah, it's at the Lymphatic Message, not massage, message with an E, because obviously I have a message about lymphatic health, and my website is thelymphatiCmessage.com.
That's great. Well, we'll put that in the show notes. And we will definitely be, shouting out when we, let this episode air, because we really want everyone to know about it. So thank you so much for coming on and sharing this with us, because I don't think a lot of people are talking about this at all.
Yes, that was my goal, is to have it reach as many people as possible so they can really develop the tools to empower themselves to take control of their health and feel great from the inside out.
Well, thank you for coming on, and thank you everyone for listening. And if you liked this episode, please take 1 minute to leave a review. I mean, it literally takes less than a minute, but we love reviews because they point people in the direction of what episodes would be good for them. So we want you to mention Lisa's episode if you loved this episode. And so thank you guys for taking time to do that. And thank you for listening. And thanks for coming on, Lisa.
Thanks so much for having me. It was such a pleasure.
Yes.
Have a great day, everybody.